My name is Lindsay Mulic. I'm from San Jose. I have diabetes and I have cystic fibrosis. I've been in and out of the hospital quite a bit. I started getting really sick in my young adult age. Probably around the age of 19 was the first time I was put on the transplant list. These are pictures of my lungs before, which were at the end stage, as they call them. And that pinhole is what I was breathing with. 5 months I was on the list and I turned it down. I think I was too scared. I didn't think my family was ready. And then when I was 26 years old, I called Stanford and said, I can't do this anymore. That was in May of 2009 when I received my transplant.
At Stanford, we have the ability to care for the patients that have cystic fibrosis and deal with all their medical complications. And so for a patient like Lindsay, that involves not only dealing with her cystic fibrosis and transplant-specific problems, but then also addressing a new medical problem that she presented with.
My mother passed away when I was 5. At the age of 32 with breast cancer, and my grandmother had breast cancer and my great aunt. So yearly after transplant I had to have mammograms, and each time they showed something. I was tested for the BRCA genes. I have the BRCA1. My risk for getting breast cancer over my lifetime was 67%, so I didn't want to deal with that risk.
It was two sort of broad paths that we could follow. One was to do preventative bilateral mastectomy surgery, diminishing and eliminating her chance of getting breast cancer. And then two would be to watch and wait.
Lindsay chose what many women choose today, is to have the most cosmetic operation for prophylaxis possible, which we call nipple-sparing mastectomy. It's an operation that really allows people to conserve sort of the whole outer shell of their breast and to look as normal as possible.
I talked to multiple friends and my sister and my family, and most everybody was on board with the situation. I just decided this is what I need to do to be able to live and be here.
Was this the first day or the second?
This was the first day because Jared...
My sister, Rebecca, she was all for it. She's by my side for everything. It's the first time outside. I talked to my transplant team and asked them if this was something I could do being a transplant patient.
Whenever any of our patients that have had a lung transplant get operated on, we have to consider the fact that their immune system is suppressed, and so their ability, for instance, to heal their wounds post-operatively is impaired, as is their ability to fight off infections post-operatively. We work closely with whatever medical team is involved to plan a course.
They were on board. They said they would be there with me, the whole time, which made me feel good, of course. So I just trusted them and went ahead with it.
Surgery went very well. We kept her an extra day or two because it was an unusual case. But overall, I think things went very smoothly, and the transplant team was very, very involved. If you choose to be tested and you do find that you are a carrier, there's a spectrum of things that can be done, from surgery like Lindsay did, which is prophylactic mastectomies, to prophylactic oophorectomies.
It's very inspiring to see somebody confront that directly and make it such an informed and inspired choice.
I would say that Lindsay's risk for developing breast cancer is probably safely reduced somewhere over 95%, if not 98 or 99%.
I want to be able to help the next person who goes through something like this, to be an example, to show them that there's a positive side of things. Not everything is negative. I can live life to the fullest after this.